Hello, everybody. My name is Dominic DiMaggio. I'm a doctoral intern at the Counseling Center here on campus, and I would like to spend a little bit of time today talking about anxiety, where it comes from, what causes it, and how we might be able to help ourselves, or when it may be time to seek professional help. So I'd like to start off to talk about stress for a moment. And you may ask, why are you talking about stress when you said you were going to talk about anxiety? Well, see, stress leads to anxiety most often. And it all depends on the persistence and intensity of the stress that is experienced, as well as the individual differences of that person who is experiencing that stressor. And as you can see on the little diagram here on the right, um, the first part, the green and the yellow, are part of a stress curve where at first it gets you motivated, gets you going, gets you working on projects, for example, or a paper. However, when the stress becomes too overwhelming and goes over to the other side, it may be exhausting, it may lead to anxiety, panic, anger, or burnout. So that's kind of the curve of anxiety, depending on how long it is, how intense, and the individual differences. What what is really kind of going on at the top of the curve and into the orange and the red is the interference with functioning. How much is that stress changing your daily life and your inability to kind of accomplish the things that you need to or want to in your daily life? So you may ask, I'm experiencing some stress, I'm feeling some things that feel like anxiety, but how do I know? What does anxiety actually look like? Well, it's a feeling of worry that is usually pretty persistent and consistent, apprehension, fear, or panic in a situation that seems overwhelming, threatening, or uncomfortable. It's that fight, flight, or freeze response that a lot of people have heard about or that's talked about a lot. Um, but however, oftentimes this anxiety is in situations that are not necessarily threatening or unsafe for us. For example, studying in the library. Something comes up for us if we have anxiety in the library that may be distressing for us that we are not aware of. But in actuality, the situation in the library is not threatening to our safety. So that's kind of where anxiety may go into the clinical range, whereas anxiety in regards to a traumatic event, that might be an appropriate response. And this is fairly common in that the APA says that about 42% of college students who go to counseling centers report their anxiety as their presenting concern. And so here, as I touched on briefly in the last slide, I wanted to give you a representation of what may look like everyday worry versus clinical anxiety. You know, worrying about paying bills, a romantic relationship or a breakup, or other important life events, feeling self-conscious or socially awkward, or tests or big life events such as presentations or being on stage, uh, or in actual dangerous situations where you might be physically harmed or after traumatic events. Those all come with typical everyday worry that is appropriate and is expected with the given circumstances. However, where it may become a little more severe and go into the lens of clinical anxiety is the constant, unsustainable worry that we don't have control over that interferes with our daily life. We begin to avoid situations, social situations, fear of being judged or embarrassed. We may experience panic attacks where we have this feeling of dread or overwhelming doom, that we may have some crying, increased heart rate or respiration, kind of losing control of ourselves. Um, and again, some avoidance of objects or peoples, and sometimes either nightmares, flashbacks, or emotional numbing. That is when it becomes a little more severe anxiety versus everyday worry that is to be expected with life. And just briefly here, I wanted to touch on some types of anxiety. And by all means, this is not an exhaustive list of all the anxiety disorders or the classifications of anxiety, but just briefly, what are the more common ones, such as generalized anxiety, having just kind of general anxiety in everyday life, not really particular to any certain situation or theme. There is social anxiety or social phobia that is particular to social engagements, being in crowds, um, and not having any relief when feeling or being more comfortable around others. There's also specific phobias such as arachnophobia, the fear of spiders. There's panic disorder, where we have those panic attacks where we lose kind of control of ourselves, lose functioning. And oftentimes, uh, anxiety can be associated or come with depressive symptoms such as like low mood, difficulty concentrating, fatigue, things like that. Other related disorders such as PTSD or post-traumatic stress disorder or obsessive compulsive disorder are also related to anxiety. Um, and that OCD or is having uncontrollable obsessive thoughts as well as uncontrollable compulsive behaviors. And PTSD is experiencing a traumatic event and having intrusive thoughts or memories about that event, and thus avoiding things that remind us or trigger those memories. So, over the next few slides, I want to go over and dispel some myths that there are out there about anxiety. One, people with anxiety can snap out of it if they try hard enough. Well, in actuality, mental health problems have nothing to do with being lazy or being weak, um, and many people need help to get better. And in actuality, therapy is really hard work. It involves a lot of exploration of yourselves and pushing yourselves to see things and understand things about yourself that you may not want to know. So people who are seeking therapy or seeking treatment for anxiety or for any number of mental health or emotional concerns, they are not weak. Matter of fact, in my eyes, they are strong, facing those things that we may not want to see. Another myth that I've heard is people with mental illness will struggle with it throughout their life. Well, in fact, there's a lot of research out there that show that people get better with therapy or with medication, specifically anxiety or depression or any other mental illness. Many people recover completely from these disorders and have a well-meaning and well-fulfilled life, and oftentimes may take a change in lifestyle, medications, or participation in therapy, but a lot of people do experience some improvement when seeking professional help. As I touched on in the introduction slide, I will be just discussing like what causes anxiety. And in actuality, there are no one specific thing that causes anxiety. So in this slide, I put it as risk factors um, for for anxiety, such as biological factors, physical illness, injury, brain chemistry, um, life experiences such as trauma, abuse, or neglect, or different situational factors. And lastly, any individual differences, how different people experience the same stressor can go into that as well. Not everybody who experiences the same thing will have the same reaction to it. So right now I want to talk about where does anxiety come from and how do and why do we experience it really? So anxiety is the evaluation in our brain or ourselves about what our nervous system is doing. Our nervous system has ways to make us feel more stressed or more peaceful. However, when we're feeling anxiety, that's when, as I talked about earlier or mentioned earlier, the fight or flight or freeze response is engaged. It's getting us ready to activate and run from a certain situation. Everybody experiences this when they are in a physical threat for their safety. For example, bears. If you are walking through the forest and you come across a bear, I would imagine everybody's adrenaline might go up a little bit. Their heartbeat will increase. Their breathing will be a little bit quicker. This is the fight or flight or freeze response kicking in. This is your sympathetic nervous system getting your body ready for action, running away from the bear, fighting the bear, which I would not recommend, but getting your body ready to go. And what happens with anxiety is this response is engaged in an event where there is no bear, there is no actual physical threat to your safety. On this slide is a little bit about what I kind of touched on in the previous slide is what is our body doing when we experience this bear or the perception of a bear, which may or may not be threatening to us. So on the right is your sympathetic nervous system that engages that fight, flight, or freeze response. When that is engaged, your eyes dilate, um, your pupils dilate in order to let more light in so you can see more things around you. Your salivatory glands shut down because we don't need to digest food or ingest food when we're fighting. Your heart rate accelerates to pump more blood into our extremities to get them ready to move. The lungs dilate in order to take in more oxygen and thus bring those to our extremities. Um, we reduce the stomach acid in our stomach because we don't need to digest food, as mentioned. And then our liver starts to stimulate glucose release. That is glucose, and that is our fuel to run, to fight, how we're moving. This is very different as opposed to our parasympathetic nervous system, which is essentially everything the opposite. It has been dubbed the rest and digest system, where it's shutting things down, getting ready for our body to rest, digest things, our brain to turn off a little bit. Um, and so this is what happens when we're experiencing anxiety. However, the anxiety that most of us are experiencing, or the worry that we're experiencing, is not being engaged at an appropriate time where we are not experiencing a bear, but more oftentimes some event or some thought or feeling that is distressing to us, that but is not causing us physical threat to our safety. I wanted to make this a little more relevant to you all, in that I'm sure that most everybody has taken an exam or a test in here, and I'd like to kind of dispel maybe what might be test anxiety versus just normal and natural worry. On the left side is normal and natural, where maybe we didn't prepare enough, we didn't study for this test, or we didn't even know that we were having it. And you come to find out that you had the test, or you know that it's coming up and you haven't prepared as well as you should. That's normal worry about the test. However, what test anxiety would be is where we feel as if we, or know as if we have studied a lot, have done everything that we've needed to do to prepare for this exam or test, but in the moment that it comes to take the test, mind goes blank, we freeze, difficulty performing on the test. That would be considered test anxiety. Here I've come up, and these are fairly common thinking styles um, that people often display when are struggling with anxiety, such as all or nothing thinking, kind of that perfectionistic tendency of like, I need to get an A on this rather than like, I'm going to do my best. Another one that I fairly see as common is catastrophizing. If I fail this test, it'll ruin my life. Um, or personalization. Um, if you didn't do well on exam, you studied well, you put some time and effort into trying to perform well on this test, um, and then you end up not saying like it's my fault, when actuality, you did everything that you could. You studied, you prepared, but the exam was more difficult than you had thought. It was on different material. The only thing you can do there is try to learn from that and do better next time. So if you catch yourself engaging any of these thinking styles, maybe try to challenge yourself. Is it really my fault? Am I going to really fail out of college if I fail this exam, or will it ruin my life? Or try to find some spectrum in performance of, I don't have to be perfect. It's not yes or no. It's, I did good enough. And how would you know if anxiety is truly a problem where you need to either alter your lifestyle or maybe potentially seek professional help? So one sign is feeling anxious more often than not, restricting your activities and ways of coping with anxiety, such as not going out to events with your friends because you might feel anxious and want to avoid that anxiety. Um, Intensifying fear in specific situations, either social events or professional events, experiencing any sort of panic attack where uncontrollable crying, feeling this impending doom, or this overwhelming feeling that you can't escape, as I kind of mentioned earlier. Um, or is the anxiety related to any specific traumatic event? At that point, you may need to kind of evaluate, are there things that I can do to help myself, or is it time to seek professional help? Some tips for relieving anxiety on your own. One, and first and foremost, is exercise. It releases dopamine within the brain, which is the feel-good hormone. Um, it is recommended to try to get at least 30 minutes of exercise or physical movement a day, whether that's going on for walks, weightlifting, going for a run, or anything else, playing sports that kind of gets your body moving, gets your heart rate up. Um, Also, eating a well-balanced diet. Some people like to say eating the rainbow, getting all your fruits and vegetables, getting different colors. Um, so trying to incorporate all of that. Um, One thing that I know I do a lot is try to focus on my sleep. Getting 7 to 8 hours a night is a good spot to be. You know, not trying to get too much less of that, and not trying to get too much more than 9 hours of sleep is really recommended. Also seeking emotional support through friends, family, loved ones, anyone that you can kind of go to. Just let them know what's going on in your life, what's stressing you out, and just get a hug from somebody that you care for. Also limiting caffeine intake. Oftentimes, if we're drinking too much caffeine, it can increase our heart rate. We can feel that kind of heart palpitations, and sometimes our bodies or our minds perceives that heart palpitations from the caffeine as anxiety or as worry, when actuality it's just the symptom of too much caffeine. One thing that I found really helpful as well is monitoring my thoughts or having a thought journal. You know, writing down where I'm at when I'm experiencing anxiety. What am I thinking? What am I feeling? Are they neutral, positive? Are they helpful or unhelpful thoughts? Things like that. Then you can really explore what is causing my anxiety. Also, mindfulness practices. I know it's really in vogue right now, mindfulness, you hear a lot about it. And I'll be talking more about mindfulness in the coming slides and how to practice it. But it is and has been proven to be very helpful for anxiety. And lastly, always feel comfortable seeking professional help, whether here at the clinic on campus or any outside provider. So as I mentioned, mindfulness is one of the most common meditative practices. It's very much in vogue right now. People are trying to practice it. Mindfulness involves focusing on the present moment intentionally and with a non-judgmental stance. And mindfulness is a part of many different types of meditation. There's movement-based meditation that everybody's familiar with via yoga. There's also Tai Chi or Qigong. There's also concentrative or sensations meditations, such as kind of mantra or breath-focused meditations. As I might bring you through a breath-focused meditation when we wrap up here, so you can kind of have it experientially. But all of these meditations as well as mindfulness practices can help alleviate anxiety symptoms. Some great apps for mindfulness or meditation um, are these here. The ones with the $ are marked as paid or free. My favorite is the Insight Timer. There are both mindfulness practices as well as guided meditations on that app. Anywhere from kind of during the middle of the day you can practice, or ones that are focused for trying to get to sleep. Those have been really helpful for me. So. And to conclude, I always want to say that we offer services here at the University Counseling Center. We're both here in Allendale as well as downtown on the Pew campus. Our hours on Allendale are 8 to 6 Monday through Thursday and 8 to 5 on Friday. And the same for Pew campus, Monday through Thursday, 8 to 5, and not offering any hours on Friday. We offer individual as well as group therapy, some psychoeducational groups, whether it's about emotions, depression, anxiety. They're usually about 4-week courses or groups that you can go in, learn about anxiety, learn some coping skills. We also have career assessment as well as career counseling at the counseling center. And if you are interested in bringing some of our services out to you or a group that you're a part of, we do have an outreach program where we can kind of come to a large group, talk about anxiety as I've talked about today, or anything else that might be on your mind regarding mental health. So I hope this has been helpful for you, learning about anxiety, where it comes from, what causes it, how we might be able to best manage it, and some services that we provide here on campus to help you out. Finally, I would like to maybe wrap up the presentation today with a mindfulness breath exercise to hopefully have you all experience what mindfulness is and hopefully be able to clear your mind just for a few minutes if that is okay with you all. So I invite you to sit up straight with your feet flat on the floor and your back straight. Either fix your eyes on a spot or close them if you'd like. Bring your attention to your breathing and observe it as if you're a curious scientist who has never encountered breathing before. Notice the air as it comes in through your nostrils and down to the bottom of your lungs. And notice it as it flows back out again. Notice the air moving in and out of your nostrils, how it slightly warmer as it comes out and slightly cooler as it goes in. Notice the subtle rise and fall of your shoulders, and the gentle rise and fall of your rib cage. And the soothing rise and fall of your abdomen. Fix your attention on one of these areas, whichever you prefer, on the breath moving in and out, on the rising and falling of your rib cage or abdomen. Keep your attention on this spot. Notice the movement in and out of the breath. Whatever feelings, urges, or sensations arise, whether pleasant or unpleasant, gently acknowledge them as if you're nodding your head at people passing by. Gently acknowledge their presence and let them be. Allow them to come and go, and keep your attention on the breath. Whatever thoughts, images, or memories arise, whether comfortable or uncomfortable, simply acknowledge them and allow them to be. Let them come and go as they please, and keep your attention on your breath. From time to time, your attention will wander as you get caught up in your thoughts. Each time this happens, notice what distracted you, then bring your attention back to the breath. No matter how often you drift off, whether 100 times or 1,000, your aim is to simply note what distracted you and refocus on your breath. Again and again and again, you'll drift off into your thoughts. This is normal and natural and happens to everyone. Our minds naturally distract us from what we are doing. So each time you realize your attention has wandered, gently acknowledge it, notice what distracted you, and return your attention to the breath. If frustration, boredom, anxiety, impatience, or other feelings arise, simply acknowledge them and maintain your focus on your breath. No matter how often your attention wanders, gently acknowledge it, note what distracted you, and refocus on your breath. And now I'd like to ask you to turn your focus and your attention to your body. Check in with yourself. Notice the feeling you have in your feet, into your legs, into your arms, into your abdomen and hips, up through your neck, and into your head. Go ahead, take a second to move your fingers or your toes, or even your legs a little bit. Wake yourself up. And when you are ready, I would like to welcome you back into the room. Thank you, everybody. Again, my name is Dominic DiMaggio. I'm a doctoral intern at the Counseling Center. I hope you all have a wonderful day. Take care.